Perfect. We are now live. Welcome to the Superlative podcast, ladies and gentlemen. I am Edward Bushi, one guest, no edits, no post-production, just a sharp live conversation about what it really takes to reach higher levels. I have with me today James Bate of AdviNOW Medical. James found that doctors spend 70% of their time trying to get paid not get sued. So he built an AI that automates everything in practice except the medical decision itself. So I'm excited to cover that with you today, James. And a big welcome to you for joining the show. And yeah, before we get into it, would love to know if, in two sentences, what AdviNOW is.
Yeah, thanks, Edward. I mean, that was a nice little introduction there. AdviNOW completely automates the medical practice. So if you think about all of the staff in a medical practice, they spend the majority of their time being data entry clerks, whether it's asking the patient for their insurance, collecting all that information at the front desk, whether it's a medical assistant, asking the 10 questions, putting them in the electronic medical record, or it's the physician themselves asking those same 10 questions and then putting them in the medical record for you. And then in the back office, what you don't see, all of that information related to billing, correlating it and entering all that information for the insurance company to actually get paid. There is a significant amount of effort in, as you mentioned in the preamble, of getting paid and not getting sued, and actually a very small amount of effort just treating the patient. And that is an inverse of what it used to be. It used to be that doctors spent the majority of their time actually helping patients and only a minority amount of their time trying to get paid and not get sued. Unfortunately, that has all been inverted recently. AdviNOW fixes that problem. Through AI capabilities, we can now allow physicians to actually practice medicine for 80 to 90% of their time and really help patients.
Yeah, I'm really excited about that. One of the things that you mentioned in our onboarding call that really out with me is nonprofits like Red Cross earn more than doctors, and I'm like,
Yeah.
wow. So okay, before we get into that, right? You come into this practice or this startup with a lot of like experience doing automation in another field. Would love to go into your background and how it informs, like where you are now with AdviNOW.
Yeah, I've been in the high technology field for 30 years. Most recently, before AdviNOW, I had the opportunity to run a business that made self-driving vehicle technologies. So we made the technologies that Tesla uses for auto brake or auto steer, Daimler, GM, Toyota. Basically, 80% of the cars out there in the market have some technology from my previous company. When we sold the business, as an officer of the company, it was a good time for me to retire. And I retired and started to look at what else I was going to do. Well, that's when I started looking at healthcare. I had a very strict non-compete, and I had to do something that was completely different. Well, healthcare is definitely completely different. I started analyzing what about healthcare I wanted to do. And my initial thought actually was not to create a technology company. It was just actually to roll up some medical practices and learn healthcare that way. And I got with a banker and I started looking at medical practices that were on the market. And what I noticed is that medical practices weren't profitable businesses in general. And that's where you go back to that comment about the Red Cross. I mean, the average net profit of a medical practice is 3%. Now, when you think about it, physicians, aren't poor individuals in general. They do make, some good money. But the physician is taking 100% risk of the business. Usually, if you work for a company, you have a salary and you have a pretty good surety that the amount of money you get is correlated to how many hours you work. In a medical practice, that isn't the case because there's no profit left in the business. 100% of the risk falls onto the physician. And so one month they may make, $5,000. The next month they make $1,000. And because of that variability, the business really just doesn't have the capability to support it. And so physicians end up taking the brunt of that. Well, That's doesn't lead you to the type of roll up that I was trying to do. I mean, because I was going to take physicians from being essentially business owners, buying their practice, and converting them into employees. Well, if a physician is an employee, what do they expect? They expect to get paid reliably and not to have variability depending on what the insurance company thought they were going to pay that month. And so that's where the whole business model of medicine fundamentally breaks. If physicians are now employees instead of business owners, then the whole concept of a roll-up doesn't make financial sense. And that's what you're seeing in the marketplace right now. That's why hospital systems are going bankrupt, even though so much money is being spent in healthcare.
Interesting. You're saying that's the one of the biggest causes. Like, I want to get into the history a little bit of this issue, because you're saying we arrived.
Didn't used to be this way.
Yeah. Like,
Yeah.
how did it that there was so much work, admin work, so to speak? Please correct me if I'm characterizing it wrong. But how did so much admin work replace the actual doctor work? Like, where did it actually happen? If you could point at it.
Yeah, so I can't say that there's like a malicious cause, if you will.
Mm.
Ultimately, in the United States and in other countries, quite frankly, doctors get paid not based off of how many hours they work, but based off of the patients that they see. And then you have to compensate physicians, whether they're doing surgeries or whether they're just consultating the patient. Do you want to pay a brain surgeon the same kind of hourly wage that you would pay, a primary care doctor who's treating, a 12-year-old kid, a pediatrics doctor? In general, you don't, right? You have to be a brain surgeon, you have 12 years of extra school after medical school is done. And so if you were going to give everyone the same compensation, we would have no brain surgeons. So the whole concept of paying physicians for a procedure or paying them, dependent on their specialty, it makes business sense. But the problem is that an insurance company wants to automate it. So they go in and say, well, this code for this procedure is what we pay. And this code for this procedure, we don't pay. And so we're going to restrict. Well, as soon as they do that, then the doctors say, well, what is the definition of a code? Well, the insurance company comes in and says, well, this code means that you will make this cut, a 3-inch, gash on a patient that you're suturing up for 12 stitches will get paid more than a 2-inch gash that has 6 stitches. And all of this type of very, very detailed stuff. And then to make it even worse, the government came in, Medicare said, we're going to define this for everybody, but we're not forcing the insurance companies to adopt what we do. But most insurance companies adopt it as a baseline, and then they add on their own restrictions that change over time. So ultimately, there is this massive framework of how do you fairly compensate somebody? And then there's government regulation, government priority, and then private that just layers onto it. And so that's the baseline of how it started. Then the problem came that insurance companies thought that they were going to become geniuses and just start changing the codes that they'll pay every quarter. So this code they'll pay one quarter. Yeah. And then the next quarter, they don't pay that code. And they say, you know what? This code and this code are similar. So we're only going to pay this code now to simplify our overwork. But doctors
can't catch up with that as a doctor.
You can't catch up with that as a doctor. And so the doctors continually are chasing insurance companies to try to get them to pay for different things. So there's a ton of problems with the system. Now, is it better than other countries? Quite frankly, yes. And other countries, you take, Canada as an example. Canada just says, hey, we don't have enough physicians that are doing orthopedic surgery. So, you need a knee replacement? You'll get that in 10 years. So they prioritize the knee replacements for people who really need them. Well, that's great, except if you know somebody, right? And so now it all becomes, who do you know to see if you can get priority to get your knee replacement? Doesn't matter how much money you want to pay. It all depends on your political connections if you can get healthcare. And so compare that to the United States, where you can always get what you want if you're willing to pay for it. I would choose the United States over having to be connected to some House representative to get my knee surgery. And so we definitely have our problems, and the complexity has created massive issues. And I'm not saying it hasn't, because it's just reality, right? But the alternative is worse. And more importantly, the AI can fix the issues we have. So artificial intelligence and technology basically takes all this oversight, the gamification that the insurance companies have played, and it short circuits it all. And it just allows the physician to go back to practicing medicine the way they did 20, 30 years ago. And we're really excited about that.
Yeah, this is very intriguing. You opened my eyes into like the kinds of battles that physicians have to like deal with, and it's not even the medical condition itself, right? So
right.
I want to get into like where is it seems AdviNOW is helping out and in the practice, but you were giving examples of code, for example, code that is like procedural based. Do the surgery this size, not this size. But that's like a very tactical medical thing. And how is AI getting into it? Because I was thinking AI is just helping in the admin, the side of things, right? How you file things, how you categorize things, but not the actual procedure. But yeah, I would love to see that distinction from you.
Yeah, so we're not really. I mean, obviously, we don't have a robot in there yet doing the procedure. But what the detail is that the insurance company will only pay for a certain type of procedure given the patient background and given the patient's symptoms and given the patient's condition.
Okay.
So let's say I'll just use that arbitrary example of a 6-inch cut and then a 4-inch cut and whether the insurance company will pay for it. Let's say a physician wants to come in for laparoscopic surgery and they come in, well, that's only a 2-inch cut. Well, the insurance company says we don't pay for sutures, we only pay for tape, right? You're going to tape over that cut. We're not going to pay for sutures. Well, what if the patient actually has some infection risk, and even though it's laparoscopic surgery, you actually need to make a 4-inch cut or an 8-inch cut to be able to get in there and really clean it out. And I'm just making some random example, right?
Okay.
Well, in that situation, the insurance company should be paying for the bigger cut, but the physician has to go and justify it. That's what AdviNOW takes care of. We'll go through, we'll collect all the information because we know all the rules that the insurance company has made up. And we will pre-qualify certain codes that, hey, the insurance company will pay for this. It won't pay for this. This is why this specific patient, and it's really down to the specific patient, their symptoms, their other conditions they may have. And it's super detailed down to the individual level. So you can't have some broad rule, right? Yeah. And that's why doctors get so confused, and there's so much waste built around how to get paid and not get sued, because everything's different for every insurance company and it's different for every patient. So AI is the way to solve that problem.
Gotcha. A part of my crude example here, but it reminds me of businesses needing accountants, right? Right? Because they need to know how to file their taxes properly, right? But the accountants would help them strategize or do the right setup, and the business are not in the business of like knowing all of these rules or how the tax code works. The doctors shouldn't be in the business of knowing how insurance products work in their totality. So I'm getting a really good example of how you're solving the problem.
100%. And
Yeah.
that's a great, analogy.
Yeah. So in that case, so the market for this must be like any size of practice, right? Like
Yep,
anybody can like start using this as using this
for
from the
sure.
get go.
Yeah.
Yeah.
Yeah. I mean, it basically hospital systems, like very large hospitals, all the way down to your single physician practice, will see a lot
Mm.
of value in the AdviNOW solution.
Yeah. One thing you at the top of this conversation we talked about, you don't automate the decision making process. The medical decision. Do you want to make that distinction? Because like I'd love to get
Yeah.
clarification on that.
Yeah. So, from an AdviNOW standpoint, we are not diagnosing or treating patients. We
Mm.
collect all the information that the physician would need to make a decision, but we are not the decision makers. So, the AI will ask all the questions, it'll predict what the doctor is going to ask, and it will ask those questions ahead of time. It will prep the orders the physician will need to place ahead of time. Oh, we'll need this lab, we'll need this image, whatever it may be.
Mm.
We will look at the insurance company guidelines and rules and clarify whether the insurance company will pay for that lab or will pay for that image. And all of that information is prepped up ahead of time for the physician so that they don't need to worry about it. So that's our goal. In our system, we correlate the symptoms to the illnesses. And so the
Mm.
physician looks, they see a list of symptoms, they see the illnesses, then they can clarify with the patient anything that needs to be clarified, and then they make that decision. So AdviNOW is just doing all the prep work, all the paperwork. At the
Mm.
same time, we're correlating it with payer rules and guidelines and regulatory compliance guidelines. So we're doing all of this simultaneously for the physician so they can just focus on the patient themselves.
Gotcha, gotcha. So if I may try to like experience be I'm gonna put myself in the shoes of a doctor right now, but and how would I expect to interface with AdviNOW? Is it something like is it like a iPad that I go to and I plug in my numbers or put in my inputs at the end of every procedure? Is it something that the front desk does? Just want to understand like the shape of the product.
Yeah, so AdviNOW has two applications, a patient-facing application and a provider-facing application.
Mm.
The patient-facing application engages with the patient before the visit, and it's a text message they get, they click on a link, and they just answer questions. It's most patients have that today, right? They have some type of engagement, answer the questions, put in their insurance information before they ever make it to the doctor's office. So
Mm.
that is something that already happens. The difference is in an AdviNOW case, it's smart data. So we're asking only the questions that the doctor would ask instead of, does your grandma have diabetes? You're being asked for the 200th time, that you go to the doctor. Every time you go to the doctor, you're asked whether your grandma has diabetes. And you're like, boy, don't have you guys figure this out? She
How
does
many
not
times
have
you have
diabetes.
to? Yeah.
you know,
Yeah.
and it's really just stupid questionnaires that are being asked. AdviNOW are smart questionnaires. So it's actually real artificial intelligence, real prediction about what the doctor needs to know and why. And that is asked to the physician up front, to the patient
Mm.
up front. So that's the patient application. The physician application is actually an embedded application inside of the electronic medical record. So every single physician office has a practice management solution or an electronic healthcare record solution.
Mm.
And this is a database that holds all the data about the patient. So you can think of people like AdviNOW or Epic. These are two, reasonably large electronic healthcare record companies. These record AdviNOW has an app that sits inside of those. So it's called an embedded application, and it serves up that one-page summary of everything the physician needs to know about it. So the physician has the healthcare record system open today. If you go to a doctor's office, most physicians have it open. They usually have their head buried in it, typing as you're talking to them.
Mm.
And AdviNOW just serves up the summary so the physician can see the summary and they can have the conversation with the patient real time.
Hmm. I was thinking of it. One of the things I wanted to follow up on is like I'm a startup person myself, and how you structure. One of the things I geek over is like the structure of the product, and how you deal with privacy, right? Because patient data is something you cannot. It's like financial data. You can't like touch it, right? Or
Yeah.
hold on to it. It seems that working with correct me if I'm wrong. It seems like you're working with other providers, and you're an integration within that, and they store the data.
Correct. Yeah. So AdviNOW doesn't retain any patient identifiable information. So anything that can connect a patient's record to the patient themselves, that's, health protected information. We don't have it. We leave all of that inside of the electronic medical record that is the software vendor that the practice uses. So we read and write from it, but we don't store it.
Gotcha, gotcha. Okay, so yeah, I really love the the product. I like how you framed it earlier in our earlier call, where you know doctors are great clinicians, but bad business people, right? So
In
it
general. Yeah.
in general, yeah. So like this helps them like run their business. So do you want to talk about like the wins that you've had like so far this year? I think you started this for several months now.
Yeah, I mean, AdviNow's been around for a while. We're
Mm.
seeing a very, very rapid growth phase right now. I mean, before ChatGPT, you talk about artificial intelligence, and everyone would start thinking about Skynet and Terminator, and and it's always a conversation about, are we going to eliminate doctors and all this other stuff, which is quite frankly a
Or
waste of
humans in
everybody's.
general.
Yeah, exactly.
Yeah.
I mean, it's not real, right? I mean, at least not yet. And so we
Mm.
got a lot of time before something like that was to happen. Um, but what we ended up with, but after ChatGPT came about and said, this is the amazing thing that we have, all this AI. Now we have to adopt it. And so that is the exciting thing for us, is that it's, I think people have come to the conclusion that they have no choice but to adopt AI. Where
Mm.
before, it's a, what is the scary AI thing? Now the scariness it maybe is still there, but that's not an inhibitor to
Mm.
adoption. Now it's, hey, if we don't adopt it, we go bankrupt. We have no choice but to adopt it. And so
Mm.
we are seeing such rapid growth. We'll do over $50 million over the next 12 months. It's a very exciting growth phase for us.
Yeah. Just going back to the problem at hand, right? Um, the the insurance environment and the government insurance environment as well, or the programs, make it very difficult to operate as a clinician, right? And it's creating all this confusion or bureaucratic confusion, right? And it leads to more admin done versus clinical work. I wonder, if AI is just, I guess what I'm trying to say is, because AI is here, I- what is your take on like, is this complexity even go even more hard? Is it going to even be is and not only for medical fields, but is complexity just a given now that AI is here, and we have to use AI? Just want your take as a founder.
Yeah, I mean, so it goes a number of ways, right?
Nice.
If you truly want to compensate people for the work done, then you need the capability of auditing the work that was done to eliminate fraud. If that is your guiding premise, then
Okay.
complexity is just here to stay. And the
Mm.
only way to deal with it is AI. Um, you can say, I live in an alternative universe where the doctor shouldn't be paid more than the janitor, and some vision like that. In that world, you don't need complexity because you don't care. but
Yeah, the rules are, yeah, gray and very black and white. Yeah.
yeah, but in a world where hey, the neurosurgeon for 12 years of medical school that you need to be a super genius to be able to do is going to be compensated differently than the nurse practitioner, that sees cuts and scrapes at CVS MinuteClinic. If that's your guiding premise, that you should be paid for the demand and the difficulty of whatever the thing is you're doing, which is, the world that the United States lives in.
Mm.
I don't know how you get away from the complexity, because a system will create people who try to abuse it. It doesn't matter what system you have. And that's why the coding system exists and all the complexity that I talked about previously.
Yeah.
Any system you devise, there will be bad actors that want to try to abuse it. And so you have to be able to design a checks and balances system to be able to see that fraud and be able to stop it so that the system works. Well, in medicine, there's 100,000 different codes for diagnosis.
Yeah.
10,000 different codes for procedures. I mean, it is just a massive, it's exponentially complex. And the reality is there should probably be more. And so I don't know how you solve that problem without AI, right? It's over the last 30 years, it's blown up to what it is today. And it's just gotten ridiculous.
Yeah.
But now we have the possibility to solve it, not by simplifying it, because I think that's fundamentally impossible, but by having artificial intelligence do the stupid work that, quite frankly, humans don't want to do and humans aren't very good at.
Yeah, so that's that. Going back to the exponential part, right? Like we're the medical frontier is always increasing, right?
Yeah.
So what we are able to do just gets piled on, and
for sure.
Yeah, so I can see a lot of, or rather, the insurance mechanisms being very reactive to that. So yeah, I have to say this has been a really interesting conversation. I really loved how you opened my eyes to how healthcare like essentially works, or rather where the bottlenecks is. So I really appreciated that. James, I want to say a big thank you for like coming over and being part of the podcast and sharing what you're building, and for folks. Well, like for example, other medical founders or other VCs who might want to reach out, what's the best way to connect?
Yeah, I could be reached at, you could learn information about the company at advinow.com, advinow.com. Info, info at advinow.com. You send an email there, someone will respond. If you want to address it to me, james.bates at advinow.com, and I'm happy to support questions. The greatest thing about coming into an industry with limited background is that you're a little bit naive to the reasons why things are the way they are. And that's a good thing and a bad thing, right? Ultimately, you're going into it and you say, this is stupid, can't we fix it? If you think out of the box, you can. And that's really the dynamic that artificial intelligence brings these industries, is that healthcare is incredibly complex, and it is broken from a systems perspective. But if we could reduce the cost of all of the oversight and admin work, then the system as is actually can work well. And so I'm really excited to see it work and to realize this dream of everyone in the United States and the world basically having access to affordable healthcare.
Yeah, totally. And I love the vision of the healthcare landscape that you helped inform me of today. It's not that we don't have the technology. It's not that we don't have the talent. It's just that we have a very hard time of remunerating the work done, right? And we're taking away time away from the talent itself. So yeah,
totally.
I appreciate this conversation, and this is one to keep in the podcast archives. So James, I want to say big thank you to you, and thank you for coming over and sharing your insights. This has been a really wonderful talk.
Thank you, Edward. I appreciate it.